Welcome back. It is time for chapter 2. This chapter we're going to talk about workforce safety and some wellness topics. It's not earth-shatteringly new. I'll try not to get too bogged down so that it isn't too long, but I don't want to shortchange you either.
Good morning, Captain.
What am I gonna do with this again? Pierce, I just got off the phone with Borough Command. Out of 12 shifts this month, you've been late for 9. Sick 4. That includes the shift where you came in late, you went home early?
Sick, that's what I've been telling you.
You're sick. You're killing me. Do you know that? You got no sick time left, according to Command. I was told to terminate.
It's okay, I'll just get my things out of my locker.
Excuse me, it's not okay. I never find anything in my life, man.
I'm sorry, Captain. Don't take it too hard.
Nobody tells me to fire anybody, ever. I told them, stick it right up your big one. Pardon me. I said, you want to fire him? Come on over and do it yourself.
You know they won't do it. It's up to you. You gotta be strong. You gotta be a man.
I am a man. Look at these. You think they give these to sissies? Come on, kid. This is a weekend of full moons. Nobody wants to work. I mean, your partner Larry's called in sick. Okay, Larry Weber, stupid Stanley, too. Come on, I need bodies out there, man. I got buses. They gotta run here. I had to put Marcus on 62 Young. Hey, you know he's not supposed to work 2 nights in a row. You know what we're in for with that one?
You swore that you'd fire me if I came in late again. You swore.
I'll fire you tomorrow. Even better than that. What was I thinking about? I could forward you some sick time. How about a week?
A week's not gonna do it. A week's not gonna do it.
Kid, you're saying no. Ain't gonna do it. You're going out with Marcus, okay? Duty calls you, kid. The city needs you, please. I'll find you sick time. I'll make it up to you, honest to God. Look at me. The next time I see you, I fire you.
I can bark, too.
Peace, you could do it all. I never said I could bark better than you. Go and help. Go and help the people in New York. Go ahead. Get out there and mop them up for me. Go ahead. Do your job. Do your job.
It's hard to tell who's stressed more. The medic that's begging to be fired that can't show up on time, or the supervisor that just randomly barks in the middle of the conversation. There's no doubt that this job is a very stressful job. And it can be really, really tough at times and thankless, but it's also a very gratifying job that demands a whole lot of us. If you haven't been stressed, if you haven't reached the breaking point yet, you probably will at some point in time. But I also want you to realize this: the stress that you may have felt as an EMT will be much greater as a paramedic. Just because the responsibility load and the tasks that you're going to have to perform are greater, and more is expected of you. So it is a stressful job, and we need to learn how to manage that. We need to learn how to take care of ourselves, so that we can survive this career, and not come out too battered and bruised. So the most important factor in all of this is your personal well-being and safety. That's really all that matters. And then, of course, we have the scene safety issues. The calls that we go on, those are important as well. It's really important that you don't do things that's going to compromise your safety, whether that's your mental well-being or your personal safety. And you need to maintain really good health and a good well-being. That's the goal. Of course, there's some data that showed that there are about 1,500 ambulance crashes in the United States every year. 1,500. Now, that's not too bad considering the most dangerous thing that any of us do is get behind the wheel of an ambulance. Second only to driving to work that particular day. So our job is inherently dangerous. The most dangerous thing that most people do is get in a car. So that makes our job, very dangerous. We're very likely to be involved in an accident. Many of the accidents that ambulances are involved in are not the fault of the ambulance. I would say, it's probably a 60-40. There's way too many of them that are the fault of whoever's in the ambulance, though. So new paramedics, as you guys are going into this field, you need to be hyper aware of your own health and well-being and what your limitations are. You can only do so much before you wind up starting getting a whole lot of limited return on what you're trying to put in. The scene is never safe. That old, I don't know how many of you guys that are with us that took your EMT class years enough back that, when we were training you, we'd have you walk in a room and go, hold your hands up, BSI, scene safe. It was a very silly way to train, but we should always assume that the scene is not safe. We're always looking for those hidden hazards in those scenes. I don't care if it's a nursing home, hospital, or on the side of the road at 2 in the morning in a snowstorm. We need to be looking for those dangers. And we should never let our guard down. Just because we found one danger and everything seems okay doesn't mean that there's something new lurking behind the next door. I know it sounds a little silly to be looking for those things, but that's what our approach to safety needs to be. We need to be aware of those things, or at least making sure we're taking those into consideration. And then we got to consider our wellness. How many of you worked with this guy? I've worked with him before, it seems like. Could be one of my partners. Your own well-being is important, whether that's both physical and especially mental and emotional well-being is a really, really important concept. You got to get away. You got to take breaks. You got to go see a counselor. Talk to your partner. Talk to your boss. Don't be afraid to speak up when things are starting to get a little too overwhelming for you. Stay away from things that you think are going to make you feel good. Those temporary patches, such as drugs or alcohol, those kinds of things. Those never work. They may work for a little while, but the chickens are going to come home to roost, and you're going to have to deal with all of those things that you were using those other methods to cover up. You're going to have to deal with them. They won't go away. They'll be there. But providers who are physically in shape are less likely to become ill or injured. They'll heal more quickly if they are injured, and they'll have generally an overall better quality of life. Not only just physically better quality of life, but emotionally and mentally, they oftentimes have a much better way of life. AHA has 7 simple facts that are meant to help improve heart health. And if we do these things, it'll increase our overall health as well, not just our heart health. And they recommend get active, control your cholesterol, eat better, manage your blood pressure, lose weight, reduce blood sugar, and stop smoking. So obviously those things, I believe we all know that living a healthy lifestyle is going to be greatly beneficial to us. Some of those things are a little easier to control than others, but that's what the American Heart Association recommends. Nutritional information changes regularly, but current guidelines are available on what's healthy and what we should eat. There are some consequences of eating the double whammy cheese bacon, or what is, no, it was the double whammy chili cheeseburger from 7-Eleven. There's consequences to eating that stuff, at 2 or 3 in the morning as you're passing through after running a call, on a long transfer call or something like that. You will pay for it. Trust me, I can attest to that. Eat foods in the suggested portions from those 6 main categories of the nutrition. And of course, you realize that each person's nutritional requirements are going to be a little different. Not everybody's going to be the same, especially someone that's working out and that's physically fit and doing those kinds of things. They're going to have different nutritional needs than those of us that kind of have a little more sedentary lifestyle, like me. So I don't require as much nutrition as someone that's working out and working 12-hour shifts and doing those kinds of things. So you can see the portions on the little choose my plate that the government came out with, and how they suggest everything should break down. All that's available on the Choose My Plate website that you can go take a peek at if you want to explore that a little bit deeper. Nutrition facts are available on almost every product that we eat, or it should be. I think that's probably some kind of law somewhere. Look at those sodium levels and the fat and carbohydrate levels, probably more so on the carbohydrate side and a little less on the fat side. There's continual research that keeps coming out, and they talk about cholesterol and fats and all that, and it's really much more leaning towards carbohydrates, glucose, blood sugar, that kind of stuff that's a little more of a problem. I think the research is still early on that, and a lot of the bigger organizations like the American Heart Association, and the cardiologists and all that stuff haven't really gotten completely on board with that. But once again, expect some things to change. You know, the more it changes, the more it stays the same. So we should expect that to change. Be aware of fat-free products. Fat-free products are not necessarily healthy. They put all kinds of chemicals and things into those products to make them taste like they're fatty because we like the fatty taste, but they're not necessarily healthy. Look for those high fiber content foods that are a whole lot healthier. Plan your shift ahead of time. Make sure you try to get enough rest. Don't go out staying out all night, or doing some other sort of activity before you're due to go on your shift the next day. Make sure you know what you want to bring and watch out for the things that you want to avoid. Make sure you plan your meals ahead. Take your meals with you. That's a little trickier for those of you that wind up sitting on post all day in a particular area, because then you're looking at taking some kind of cooler, ice chest, and then how do you warm your food up? Some challenges that might be difficult to overcome. But think about this: if you're routinely on post somewhere where there's, say, a 7-Eleven or a convenience store, something like that's got a microwave, you might be able to warm something up there. I'm just saying that might be an option. Where there's a will, there's a way to eat healthy. Oftentimes, when we're trying to eat healthy, it's not that the food that we're eating isn't doing us any good. It's just that we get bored with it, and we want something new, and that's when we start to venture out and we fall off the wagon and start eating garbage again. The U.S. Department of Agriculture does have some guidelines for weight control to help you get that under control. Making healthy food choices and avoiding dieting is a good way to do it. Dieting is it's really a misnomer. Dieting doesn't really work. What you need to do is change your eating habit, and there's a lot of research on that. And there's a whole host of places that you can go look and find a meal plan that will work towards losing weight. Gradual weight reduction is the key. Of course, I know you guys have all heard about the GLP-1 drugs that are out there, like Wegovy and Ozempic and all of those kinds of drugs that were originally developed as a type 2 diabetes drug and injectable. And now the side effect of that is they found out that people lose up to 20% of their total weight when they're on those, some even more. It's very similar to several years ago, probably 15 years ago, Wellbutrin was a antidepressant drug that came out, and they discovered that people that were on Wellbutrin, that started taking Wellbutrin, if they were smokers or tobacco users, they stopped taking tobacco. Well, that led to the development of the drug now that they prescribe for stopping smoking or stopping tobacco use, and I can't remember the name of that right offhand, but it'll probably come to me at some random moment as we move through this, so don't be surprised if I shout it out. Benefits of exercise. Of course, there's tons of benefits of exercising, and setting up a workout routine, a workout program is beneficial. It can be difficult depending on the shift work that you do. If your shifts are a little more what I call random, or at least not very predictable. You work every Tuesday and Thursday, or something like that. It can be difficult to set up a routine, workout routine, but it can be done. Don't use that as an excuse. And of course, the exercising is hugely beneficial because it really helps you actually be able to do the things that you do at work, lifting and moving people and doing all of that kind of stuff, and it reduces the likelihood of you becoming injured. So your program should be targeted at maintaining or improving your cardiovascular endurance, flexibility, and physical strength, rather than weight loss. Oftentimes, if you eat healthy and then exercise, you're going to put muscle on. I'm going to tell you right now, it's a complete myth that you can exercise away a bad diet. You literally cannot do it. If you eat 800 calorie Big Mac or whatever they are, I think they're 600 or 800 calories, you would literally have to spend about 4 hours on an exercise bike to work that off. It's not going to happen. So what you have to do is you have to monitor your nutritional intake and adjust your caloric intake based on the amount of calories that you burn in a particular day. And you don't have to base it on calories. You can base it on, whatever method is out there that you feel like works for you if you're wanting weight loss. But we're just talking about exercise program shouldn't be geared towards weight loss. It should be geared towards physical improvements. Talk to your doctor before you go nuts with an exercise program. 30 minutes of moderate exercise, moderate to vigorous exercise every day is what's recommended. And you want to try to reach that target heart rate, which is based on your age and gender and weight, and a few other things like that. Of course, stopping tobacco, any kind of tobacco use, smokings, and that's even vapes and all that kind of stuff. The effects of nicotine on the body, even if you're vaping and you're not dealing with the tar, which the tar is going to cause damage to your mainly your lungs and that kind those areas. The nicotine is just wreaking havoc on the blood vessels in your body, and they're leading you down the pathway of heart attacks and strokes. So those are the kind of things you want to watch out for and you want to avoid. Alcohol use, oftentimes too often medics will try to self-medicate with alcohol. In moderation, it's really not that big of a deal, but once you cross the threshold and you start getting into alcoholism, you can see how the damage that it does to the brain and the heart, the pancreas, and especially the liver. Some atherosclerosis will develop, reproductive dysfunctions, and all those kinds of things. You may have the perception that it's alleviating your stress, but remember, alcohol is a depressant, and your stress is probably causing depression, maybe some anxiety, but depression and anxiety often go hand in hand. You really don't want to take a drug that further depresses you. It's just not a good idea. Of course, the type of shift work that we do often really messes with our circadian rhythms. Those wake-sleep cycles. If you're working a 12-hour shift overnight, you're sleeping during the day, your body wants to be awake when the sun's out and asleep when the sun's down. It's really difficult. It's really stressful on our body. It's one of those unseen forms of stress that we don't often really associate with stress. We think about, the 3-year-old that was thrown from a vehicle and run over by a tractor trailer that we have to go and see. But we know that stress, we recognize that stress, but these are some of the hidden stresses that we don't really recognize, as contributing to the overall stresses that we have. So there are some ways that you can deal with shift work, and you feel free to look those up and work with, try to make sure that you understand those and how those can help you. And you for sure make sure you don't overlook the need for sleep. Working sleep deprived is basically the same as working intoxicated. And of course, that's not at all fair to our patients when we do that. Check on your heart. Check on your health of your heart. Just a little bit of full disclosure, whether you want to know it or not, I'm going to tell you. I started taking blood pressure medicine at about the age of 35. I was devastated that I had the old man disease, is what I looked at it as. In my research, the more I learned about high blood pressure and heart disease and those kinds of things, I realized how lucky I was. I am one of the very few that actually has symptomatic high blood pressure, meaning I know when my blood pressure's up. Most people don't have that. They go through, their life, their 20s and 30s without any symptoms, and they get into their 40s, early 50s, and all of a sudden they have a heart attack or a stroke out of the blue, and it doesn't make sense because they've been healthy. They're a healthy person. They go to the gym. They do all these kinds of things. It just doesn't make any sense. Well, it does make sense. They've had high blood pressure untreated all this time, and it's wreaked havoc on their body. This is especially true for the African American population, especially the men. Oftentimes their high blood pressure goes untreated. And we lose so many of them early in life. And what I mean by early, in their 40s and 50s, we lose some amazing people because of not controlling those risk factors and doing these periodic health assessments. So do yourself a favor, go get things checked out. Just do an annual checkup where you go in, you get lab work done. They take your blood pressure, they do all kinds of things. The doc checks you out. It'll really, really be helpful. Some employers actually provide that. My work actually provides that. I don't need it because I see a doctor pretty regularly. But make sure you're doing those periodic health assessments. Body mechanics is extremely important. We lift and move patients in so many different ways and places. It, I mean, we always think, oftentimes we think of the easy things like, oh, we're moving them from this bed to that bed, or picking them up and putting them on the cot, or, those kinds of things. But, when you're picking them up out of a bathtub that's a small bathroom, and you've got the toilet, right next to the bathtub, and you're trying to get them out, and they've got a broken hip, and, there's just so many different ways that we wind up lifting people to where that our body mechanics are terrible and we can't do much about it. So always be very thoughtful when you're moving a patient, especially when they're in one of those precarious situations. So one way to do that is to develop some habits, some good healthy habits. Try to minimize the total number of body lifts that you do. Remember, the more stress that you put on the joints in your body, the more you're going to pay for it. Myself, I have issues with my shoulders and my hips, from lifting and moving patients because I'm not a big guy. And the way that I had to shift my weight and do things impacted those joints more so. I've had both ankles worked on. Fortunately, my knees have been good. They're about the only ones. I got bad elbows and all that. So this job will affect you. Fortunately, they've come up with the new technology with the ambulance cots and stair chairs and that kind of stuff wasn't available for 90% of my career. So you guys are going to probably come out of this better than me. At least I hope so. And hopefully you'll have a more longevity in your career than us old guys did. So also make sure you're not lifting alone and you coordinate that. And minimize the total weight that you have to lift, as much as you can. Sometimes it's just not possible when it's just you and your partner out in the middle of nowhere, and you got a 250-pound patient you got to haul out of a little bitty bathroom. It's not pleasant, but it does happen. So lift with your back. Always think that. I know they say that, but always do that. I've had many friends, many medic friends that's had back surgery. A couple of them have had career-ending back injuries. One or two of them, I know one of them wound up with a heavy drug addiction because of it, and we almost lost him. So these injuries can be devastating, so make sure you take some precautions when you're lifting these people, because some of these injuries can be very, very serious. And they may impact you for the rest of your life if you don't do it right. So it's well worth taking the time. I love this one. Don't carry what you can put on wheels. That should be my mantra. I'm always looking for an easier way to do something, and maybe that just plays right into my laziness. But it's really, really handy that you put it on wheels instead of lugging it around. Especially if you're going across an uneven surface like a front yard or something like that. That's terrible. Ask, and of course ask for help. I've had cops help me. They don't want to help, and if they know you're going to ask, they will have already disappeared. But I'll go track them down and go, hey, we need a hand in here, and they can't say no because the family's standing right there. So make sure you ask for help. I talked about this a little bit, but your mental well-being is something that you just can't overlook. It's as important as your physical well-being. It's equally as important, if not more so, because if your mental well-being takes a tank and it plummets, it's going to affect every single aspect of your life, including your physical well-being. Your mental well-being will destroy you physically as well. So it's really, really important to take the time and realize when you're in too deep, when the stress level is too much, and when you need help. When you're subjected to a lot of stress, you wind up with that fight or flight response. And that's why it's really, really important to try to control your emotions. Sometimes you can't. And as you get more experience, that fight or flight response trigger will be less and less because, they kind of been there, done that. You're kind of laid back and mellow about it. People don't really understand how you don't get excited about something, and it's because, this is nothing compared to what you've been through, right? But that fight or flight response, that does some other things too. Let's say you're borderline high blood pressure. Fight or flight response kicks in, you run several calls that kicks that thing in, it's going to raise your blood pressure. Your blood pressure is going to be high for maybe the whole shift. and it may take a while after your shift for that to come back down to a pre-high blood hypertension level. So that fight or flight response does a lot of things inside of our bodies that we sometimes don't really think too much about, but yet it impacts us greatly, because it's not like we're having a one-off, where we walk outside and we're scared by a raccoon or something, and it's like, oh my gosh, and heart rate goes up and blood pressure and all that stuff goes up, and we're out of breath and we're scared and panicking. We don't quite get it that bad, but we get small to medium doses of it throughout a shift. Over the course of 12 hours, we get small to medium doses of that, maybe 4, 6, 8 times. And the other person that got that 30-second scare, they're not getting near the adrenaline rush that we wind up getting from the fight or flight. And that over the course of a career can be really, really hard on our bodies. So we need to learn how to manage that and negate that. And if you need to walk away after the call to kind of get everything to calm back down, it's really, really helpful. Try to create that work and home life balance. Don't be all about EMS. I see less and less of this nowadays, though I still see some of it, but it's usually somebody brand new in EMS. They're kind of what we call ate up with it. Typically at the paramedic level, it doesn't happen a lot unless they're just kind of a company person. But yet we're seeing less and less of this because the companies are recognizing that they're burning people out, and they wind up losing them because of that, or they harm them emotionally. So make sure you get a good life balance. Spiritual balance or spiritual well-being is a really good way to do things too. And of course, we're just talking about that unseen dimension of human experience. You may or may not believe in it, but those of you that do know that it adds to your overall well-being. So medical experts also support the dignity and value of life and the sacredness of all people. So even if it's not something that you partake in or that you believe in, realize you're going to have patients and partners and other people that do. And it may be a very large part or a very important part of their life. And I'm not talking about any one particular religion. It could be any number of religions, and it may not even be a true religion, where, some people believe that there is something higher, but maybe we don't know exactly what that's called. So, but that spiritual well-being is important. It is helpful to have that connection somewhere in the great beyond, for lack of a better words. Disease transmission is something that we always have to deal with. Like it or not, it's going to be out there. It's something that I've had to deal with my entire career. I started in the early 90s, late 80s, early 90s. HIV and AIDS was rampant, and that was the big fear. We were all terrified of that. Literally, when I started was when it first became common practice for you to wear gloves on every patient. I remember them telling me that. It's like, okay, now remember, we wear gloves with every patient now. And I'm like, you mean you didn't before? And they're like, no, they just started making us do this. So I'm like, wow, that's a little crazy. But that's the way it is, or the way it was then. So they didn't wear gloves. And that's how, when in chapter 1, when I talked about how the profession has progressed, that's one of the things, things have changed. We wear gloves on everybody now. Well, it's because of all these diseases and everything that are out there. And we always think that we're wearing these gloves to protect us, which is true, but we're also wearing these gloves and these other pieces of personal protective equipment to protect future patients that we will have in our, in our vicinity, or even family members. So we're not transmitting diseases to them. Some of these patients are extremely vulnerable. So those are the kind of things we need to be aware of. And often, and that is why, every hospital requires students to have all of their immunizations and vaccinations before you can go to clinicals there, is because they're not thinking about protecting you. Sadly, they don't care about you. They care about their patients. They don't want you bringing in and exposing their patients to an illness that's going to cost them money in the form of a lawsuit. So that's why they do that. Okay, and we also should make sure that we're keeping everybody informed when we do come across something, when we do contact something with a patient. Um, of course, you all should know by now that these diseases can be transported in a variety of different ways, such as direct contact or indirect contact. It can be airborne, it can be foodborne, it can be vector-borne, any number of ways. Um, Originally, when COVID came out, they didn't realize, they wasn't sure if it was direct or indirect contact, and then pretty quickly they discovered that it was airborne. And then those of you that remember, we had the 6 foot distancing. So we had to go in all the classrooms and distance all the chairs and tables by 6 feet. Shortly after we'd done all this, and we continued to do this, but Harvard did a study and they said the distance between people needed to be 60 feet for it to be meaningful in the least bit. 6 feet did nothing. And yet I still will go into a convenience store or somewhere and there's people standing in line. They're standing 6 feet apart. It just cracks me up how over the course of that 1 year of 2020, when all that stuff hit and everybody panicked because we did not know what was going to come of that, and everybody distanced by 6 feet, they still do it today. It's fascinating, how people do that. Now I'm seeing it it's slowly fading away. It's like 4 feet, 6 feet, 2 feet. Before you know it, we'll be, standing in each other's shoes, standing in line. But as of right now, we still do a little social distancing. I do it just because, around here sometimes people smell funny, and I just stay away from them. Sometimes, and when somebody's standing away from me, I'm like, am I the one that smells funny? Maybe so. Who knows? In those rare and unlikely events that there is an exposure, the process is relatively straightforward. You're just going to follow the exposure control plan of that department. Some of those departments follow the hospital's exposure control plan because usually a hospital's exposure control plan is much more robust. And of course, they have all the resources. So regardless if you're following your department's plan, your EMS department's plan, or your fire department's plan, it's probably going to involve a clinic or a hospital, because they have the resources to be able to do the things that need to be done. If the exposure is significant, you may actually have to turn over care to another crew, another EMS provider. Of course, wash the affected area with soap and water. Nothing beats good old soap and water. If it's in the eyes, rinse them with water. And of course, you need to report it, get whatever medical attention. Once again, you're following that infection control plan. If there's immunization and boosters that you need, go ahead and get them. And of course, fully document the incident. And there may be some follow-ups that you have to do, some routine testing. More than likely, they're going to test the patient. I believe it was the Ryan White Act that made it possible to where that if you were exposed while you were doing your job as a medic, they can test that patient without their consent because it has to do with protecting your well-being. And if you can catch something soon enough, you can keep it from getting out of hand, and that's the idea. So they can protect the patient. Of course, COVID-19 really made us think about a lot of things, and a lot of things changed after that. A lot of EMS practices that we did then, or we did before then, we've changed. And of course, it's going to change, it's going to reshape. We know now that social distancing didn't work. We also know that most of the masks and the masking and all that stuff that we were doing didn't work. We know that, children were much less susceptible to it. They also thought that people with comorbidities were in much more trouble, like if you had high blood pressure and asthma and, those kind of comorbidities like that, or a respiratory issue and cardiac issues, that kind of thing, that you were much more likely to get the bad COVID. I had COVID 3 times and I never got the bad. The first one was pretty rough, but I never got the bad COVID. So they really don't know with COVID what the magic thing was about it, whether or not it impacted you greatly or not. I heard about people that were very healthy that wound up in the hospital and dying from it. So And the vaccination side of things is a whole different story. That a lot of people come, have very strong opinions both ways about the vaccinations. Fortunately, the vaccination fad or phase or pressure to get the vaccination has dramatically faded, almost to non-existent. And you guys as students do have the ability to opt out of the vaccine, so that's some good news. I I'm kind of either way when it comes to vaccinations. I think that's honestly a personal choice. Um, but I do know that we're starting to see a resurgence of some mumps and stuff like that because people have opted out of those. And some of those diseases are starting to make a comeback among our kids. So it's a little concerning, but yet, I understand. I understand where people come from. So, of course, follow standard precautions. Remember, those standard precautions are, the basic stuff like gloves and, that kind of thing. But, as that situation worsens or the varying situation, if it's messier or something like that, you're going to have to gown up and maybe shields and masks. And, of course, when you're intubating or doing airway stuff, you should be wearing masks and shields anyway. Of course, making sure you do your annual exams, keeping up with immunizations, and all of that kind of stuff will really help with you maintaining your own personal health and reducing the likelihood that you're going to catch something. It's funny though, EMS people and ER nurses and ER physicians are some people that get the least amount of illnesses. You rarely see them sick, and they're exposed to everything. They must just have tremendous immune systems. So, of course, we have tons of different types of personal protective equipment. Gloves, facial protection gowns. The N95 masks actually did do some good with COVID, but crap, you couldn't get them. 15 days into it, ambulance services couldn't even get them. And then everybody was using the cheap Chinese ones, which we're not really sure were working really well either. So, and of course, when things start to get really serious, there's a lot of other things that we can employ as well. But of course, wearing gloves, washing your hands, using some hand lotion. Actually, hand lotion helps kill some of the microbes as well. Eye protection. There's a lot of things that we do in the field as paramedics that do require us to wear some form of eye protection to keep from particles and things splashing in our eyes. And of course, wearing a mask. Typically, those two go hand in hand. When we have splash precautions, and of course, protecting your body, from those kinds of things. There are different kinds of, respirators. I don't know why that's on there twice. Kind of weird. It was there and there. So make sure your ambulance and your equipment is clean, so we're not spreading things from one patient to the other. Get rid of sharps in their proper place. And this is wear appropriate turnout gear, but we're going to wear appropriate PPE for the given situation, whether that's a gown or something even heavier, that kind of thing, but probably not turnout gear, unless you are in the fire service. Of course, protect your eyes, ears, and skin. And in some places, they do wear body armor. They do wear bulletproof vests and body armor. Kevlar and body armor is kind of standard equipment in some services in some areas. To my knowledge, nobody in Oklahoma is doing that. But I wouldn't make fun of somebody if they were posted in a certain area. I wouldn't pick on them because they did, just because crazy things happen. We always have hostile situations, or from time to time we have these hostile situations that we go into. Hopefully we know before we go into them that it is a hostile situation. But in those cases, we shouldn't be the first one to get there. Be highly critical of the situation and really evaluate things out. Make sure if you don't feel right about it, have law enforcement come make sure everything's okay. Typically they don't mind. However, law enforcement's got its struggles as well with trying to get people. Once you get in contact with that patient, do a lot more listening than talking. Try not to argue or ridicule them. and use those de-escalation skills to kind of get their emotions down. Be empathetic. You can be empathetic and not believe a word they're saying. It's not difficult to do, but don't be so fake in your empathy that they catch on to what you're doing, because you're going to have a problem then. And always stay aware of your environment. Just because you have one hostile person doesn't mean that's the only hostile person there. It is very possible to have that there's more than one. There could be something affecting that entire situation. Traffic accidents is probably one of the times when we're the most exposed, and the risks for our safety are pretty high. So make sure that it's all eyes. Everybody's looking out for everybody, and everybody's paying attention. This is really tough, especially when you've got, like a new EMT student riding along with you. Now you're watching out for somebody that has no idea what they're doing, and that can be a little tricky. It does add to the stress a bit, trying to make sure you're keeping them safe as well. And of course, always stay aware of your surroundings. Probably my most anxious times at the scene was, when we were using the old Jaws of Life, and they would have to start the hydraulic pump for that, the gas-powered pump for that, and that thing would be running, and it'd be really loud close to the vehicle, and I couldn't hear anything else but that. I get a little nervous when I can't use all of my senses, so it's really important at these traffic accidents that you're using all of your senses. You're paying attention to everything, including smell, sight, hearing, all of those, touch, just so there's no surprises, nothing sneaks up on you. Of course, as you're approaching the scene, make sure you're looking way ahead. And when you pull up, make sure you're looking at your surroundings, looking for any of those hazards, and don't just blindly walk into something, because you can get yourself in trouble without even realizing how much trouble you're in. Typically, or it's really easy to walk into something at night, especially in automobile accidents, because it's really hard for us to see everything. I recall standing underneath a telephone pole that was dangling by the wires of the pole, and it was a big pole, and none of us knew it. For some reason, I looked up, and this thing's about 12 feet above my head, and I told one of the firefighters, I said, "We got to go." And, of course, we got out of there pretty quickly, but we were extricating a patient. It just so happened to be right over the driver's side door where we were getting somebody out. If it would have dropped, it would have killed 2 or 3 of us easily. So at night, sometimes we can't see those hazards, so that's why we got to be a little more diligent. Ironically enough, I didn't know this slide was coming up, but power lines create a unique hazard for us, because those things can kill from a distance. They can be on the ground, and the voltage can travel through the ground, and get us, from a distance. So it's really important that we're very, very cautious of those, and give them a large, a large wall to stay around. Mark that off so we can keep other people out, and stay inside your truck, if you have to, but just don't mess around with power lines. If there's lightning hazards and those kinds of things, as much as we want to get that patient or those patients out of a particular situation, if there's a danger of lightning striking, we may have to stay back. We may have to stay out of that. We're definitely not equipped for that. Here's a video about stress, and it may seem a little corny, but it kind of gives you an idea of how stress impacts our bodies and what it does to us.
Although I enjoy cats, I must say that I'm really more of a dog person, and a couple years ago, or I guess 1 year ago now, my wife got me a puppy dog for my birthday, and she got me a little beagle, and his name is Hank. And like most beagles, my puppy dog Hank loves to chase bunny rabbits, but it's not so much a friendly game of chase that he's playing with this bunny rabbit. Hank is actually pretty intent on swallowing the bunny rabbit whole as soon as he catches it. And so you might say that in this picture, this bunny is experiencing a little bit of stress, and in doing so, we'd be using that word to describe a threat or a challenge. However, we might also say that the bunny is stressed. And now we're talking about the bunny's response. And so psychologists try to clarify this really slippery definition by calling the threatening or challenging event, which in this case is the imminent clamping down of my puppy dog's teeth, the stressor. So stressor. So my puppy dog's teeth are the stressor, and then the subsequent physical and emotional response would be the stress reaction. So in this case, we're talking about the bunny's response, that physical and emotional response to the stressor. So this whole scene then is what a psychologist might call stress. So then, stress isn't really just a stimulus or a response. Rather, it's kind of the process by which we appraise and we cope with the environmental threats and challenges. So we're appraising the stressor, and then our stress reaction is our coping with that environmental threat or the challenge. So based off this definition of stress, a pretty famous psychologist named Richard Lazarus, he determined that stress arises less from actual events and more from our assessment of those events. And the word he used to describe that assessment was our appraisal. And in describing this appraisal, he suggested that there were really two stages to the cognitive appraisal of stress. So you have primary appraisal, and primary appraisal is the initial evaluation that focuses on the threat in the present situation. So what is your appraisal of what's going on right now, what threat I'm experiencing right now? And there are three categories of response to this primary appraisal. For instance, one response might be that whatever this perceived threat is really irrelevant to me. Maybe it doesn't matter at all. That's kind of what irrelevant means. Just that I see this threat, but it's not affecting me. I'm not in danger at all. I don't find this to be particularly important, so it's irrelevant. Another response, even better than an irrelevant response, might be a benign or a positive response. So benign or positive, and maybe this threat, maybe for example a bird sees a dinosaur stomping through the forest, but that dinosaur is actually kind of a positive threat because it's about to take out one of the bird's enemies. So we might have a benign or a positive response to this stress. And then the last kind of major category of response would be that this event is actually stressful. And in this case, we're finding that stressor to be potentially harmful or challenging or threatening. So if you look back over to this example here, if I'm the rabbit in this picture, my appraisal of this situation is deeming like crazy that this is in the stressful category. And so if this primary appraisal is negative, we move forward with the second appraisal. So the secondary appraisal involves the evaluation of the individual's ability to cope with the situation. So the individual that's perceiving the stressor, what is their material preparedness to deal with that stressor? And so you have a further appraisal of harm, and what that's saying is what damage has already been caused. So if you're this rabbit, no damage has been caused yet, but gosh, that beagle puppy is nipping at your heels. And so that brings us to the second category of secondary appraisal, and that's an appraisal of the threat. So what future damage could be caused? And in this case, if you're that rabbit, lots of damage could be caused. For instance, my entire leg meat might be pierced by some sharp as heck puppy dog teeth here in just a couple of seconds. So that threat is quite high. And then the third category of secondary appraisal, the third further assessment, is of the challenge. And so how that describes how can the situation be overcome or conquered. And if I'm that rabbit, I'm thinking I can run like the Dickens and try to make it back to my little rabbit hutch. And so this is a pretty straightforward concept for most of the animal world. There's a stressor and then a stress reaction, and a stressor and a stress reaction, and it goes and so on. But for humans, it's a little bit different because as humans, we have this higher level of cognitive functioning than the other animals in the world, and we have this seemingly unique ability to not only respond to stressors, so not only have a stress reaction, but also to anticipate stressors. And that makes the whole triggering and the duration and the response to stress really a little more interesting. And those are the topics that we're going to cover as we explore the psychology of stress in the next videos.
So, how do you guys fit into that? Well, guess what? You guys are the rabbit. So we're the rabbit in this. We're the one that deals with, we have the reaction to the stress. Our job is the stressor. Our reaction to it is the stress. The more acclimated we become to that, the more used to the stressors we become, the less it impacts us. Early on in our careers, though, everything is a stressor. As we get a little more settled and a little more used to it, it becomes less and less that. There's other things that are stressors and other things that we deal with. You making the move to be a paramedic is going to pile more stress onto you. It's going to add more stressors. That's just the nature of it. That's what it's going to do. Your role is going to be different. So we all know this is a high stress job, but understanding what causes those stressors or what triggers that stress in us is going to be helpful. I'm not going to spend a whole lot of time on this. I know we've talked a lot about stress, so much so that you're probably getting stressed out by it. But what you need to understand is what stress is, what its effects on you are, what you can do to minimize those effects, and then how you can deal with that on an emotional level. It's really important. Remember, we talked about emotional well-being. Stress can really mess up your emotional and physical well-being as well. When your brain's messed up, your body's going to follow. That's just the way it works. Any event can cause us to react physically, emotionally, or mentally is considered stressful. And any of the events that we go on has the potential to do that. It all just depends. What may affect you may not affect somebody else. We all have a different history to us. Something may be familial to us to where it's familiar and it causes us to stress out because we kind of shared in a similar experience and we're living off of the stress from the old experience has now made its way into the current one. Of course, stress is really considered neither good nor bad, but how we respond to that stress is really what's really important. The reaction to that is what causes the issue. Stress can actually be beneficial because sometimes we adapt to it. Sometimes it's a good thing, and we're able to adapt to the stressor in a way that's going to be beneficial to us in the future. However, it's when we don't adapt to that well, or the stress becomes so overwhelming that our response to it is not good, then it starts to become unhealthy. So not all stress is bad. Sometimes a little stress is good. You're going to find out. You're going to learn about some of that good stress in class. Where you're going to get stressed out in the classroom. You're going to get some stress in the lab. But that stress is all designed for a purpose. It's designed to help you grow and not to, cause you, further issues down the road. It's to head off some of those stresses that you might have later in the job, but we can do that in a healthy way in the classroom and in the lab. So what triggers it? Of course, it often begins with events that are perceived as threatening or demanding. So when our perception of something doesn't mean that it is threatening or demanding. It's just our perception of it being threatening or demanding. We could be in a situation where we're being held hostage by a guy that we know has killed 127 people. And he's got a gun to our head. He could give or take about life. But for whatever reason, if you're not really bothered by it, if you don't perceive it as a threat, you're not going to be stressed by it. I don't know how you wouldn't be, but you're not going to be stressed by it. It's not going to be stressful to you because you're all right with it. You're just going to deal with it differently. So, but a lot of things can contribute to that. lifestyle changes, it doesn't always have to be at work. Sometimes what we have going on at home can be really, really tough to deal with. Starting a new relationship, ending an old relationship, buying a house, selling a house, remodeling a house, dealing with kids, all kinds of different things can be stressors to us. Many of them we're able to utilize and grow from them, but some of them really stick around and they do some damage. Acute stress is when things start to go over the edge. When a person perceives the event as threatening, a series of psychological reactions are triggered. And this is where we get that fight or flight response. So regular stress, maybe not such a problem. Acute stress, we got a problem. And that fight or flight response is when we really start to, over a long period of time or over successive times, is when we start to do some damage. Of course, our reactions to that stress can be acute. It can just happen. We may, freak out right then, or whatever's going to happen to it right then. It could be delayed. It may not seem like nothing, and then all of a sudden, out of the blue, it just kind of hits you, and you don't even realize what it is. Or it could even be cumulative. Oftentimes with medics, it's cumulative. It's just, they keep piling and piling and piling it on. And we have a tendency to try to kind of push those things down and pack them down. And it's like, no, it's not that. Or I don't have time to deal with that. And it gets cumulative. And before long, the dam bursts. And then we have a real problem. Of course, we've talked about how it can rear its ugly head in different physical and physiological symptoms. But if it's prolonged stress, it's of course a strong contributor to heart disease, high blood pressure, cancer, depression, job burnout. Now, my family does have a history of high blood pressure, but I am the youngest one in my family to wind up on blood pressure medicine. I'm also the one in my family that takes multiple medications for my blood pressure, and at times still struggles to keep it under control. I 100% contribute the difficulties in keeping my blood pressure under control to my job. I was going to have high blood pressure, and I may have very well even had it starting in my 30s. It's just a little harder to manage, in part because of all the stress that I dealt with, early on, in my young adulthood, that had an impact on my health. And I share that not because, I like to just share personal information. I share that because I want you guys to come out of this healthier. I want you guys to recognize those stressors when I didn't recognize them. I choked them down, I pushed them down, and it started to show itself in the damage that it was doing to my cardiovascular system. Fortunately, all is working well there, but it took a while to get everything back to normal or back to good where it needed to be. So if you guys can just start out knowing that you're going to have to figure out ways to deal with that, you're a whole lot better off than me. We really didn't know those things back then. Our response that we have to our patients and the injuries that we see and the illnesses that we see are determined by the way that we adapt to stress. Common reactions include like things like fear, anxiety, depression, anger, even sometimes confusion, are not uncommon ways for us to deal with those things. Now, doesn't mean that you're going to have to deal with those things every single time that you go on a call. No, you're going to adapt to where those things have lesser of an impact on you. But some things will, and your reaction to them may be any number of ways. The concern is when your reaction is so great that it impairs your ability to care for the patient. That's when it really becomes a big concern, when you're not able to take care of your patient. Has that ever happened to me? Probably. I can't think of a particular instance right off the top of my head, but I'm sure that I've been so stressed to the point that it impacted my patient care. So it's really important to make sure that the stressors don't accumulate on you, to where even a small stressor impacts your patient care. So um, things to be aware of. Some defense mechanisms that we have, of course, the one we're great at is denial. Deny, deny, deny. It doesn't work. I'm just telling you right now, it doesn't work. Regression, some of us will regress, some of us will project, we'll blame it on others, or even displace that. Um, the reactions to these are often rooted in the culture of it. So patients deal with these stressors and they deal with things as well, just like we do. So it's not unusual for patients to undergo stress and denying their, the illnesses and diseases that they're going through. So patients and bystanders and family members, oftentimes they're the ones more so than the patients that we have to deal with when it comes to stress. They're panicked, they're scared, they want you to do something, they want you to fix it. If their stress becomes so great, it may limit your ability to take care of the patient, because now you've got to focus on them, because they may actually become a hazard or a potential hazard that you have to deal with because they're so upset. And that's typically only when they get angry, when their response to their stress is anger. Now, sometimes the response is, the opposite, where it's, fear and, all that. So that's a little different. It's really important, though, while we're doing this, is to not take it personally. Nobody ever told me this early on in my career, that, when a patient's family members cuss you out or threaten to beat you up or tell you they're going to meet you in the parking lot at the hospital when we're done, that kind of thing, and as I mentioned before, I'm not a big guy, so when a big guy tells me that, it's a real threat, so it causes me some stress. But nobody ever told me don't take that personally, that it's where they're at that moment. So really just need to remain calm. Don't be combative. Don't reciprocate the language. I've had many, 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 many family members apologize to me at the hospital after having said something. Fortunately, I had, like I said, I wasn't a big guy, so I had a tendency not to mouth back, and I would either just say nothing or try to be reassuring, and usually that diffused the situation. And like I said, I'd wind up with an apology when we got back to the hospital, or when everything was said and done. When you can remove people from the situation, it's helpful, but it's not always good to just kind of leave them alone, because it can cause some anxiety, blind panic, and overreaction, all those kinds of things. Recent research actually has patient family members with the patient as much as possible, so they see everything that's being done, that's trying to be done, and that kind of stuff. Of course, there's always a risk of somebody doing something wrong, that the family members can try to hang their hat on and sue or whatever, cast blame. But more and more they're allowing family members to be there, even when they're say working somebody in cardiac arrest in the hospital. Family members are allowed to be there as much as possible anyway, at least they had been. Of course, like I've said, we're not immune to it. Try not to get irritated with the patient who doesn't seem ill or injured. It's really, really hard for us to do when they, we're set down for the only meal that we've actually got to stop for the day, and we get called out in the middle of it. No, we're going to have to eat our food cold now, because somebody called us out. And they call us out for any number of reasons. I honestly believe that many of them do not realize that they are inconveniencing us, or there's the perception of that, or that they don't think that, hey, look, you're taking a truck out of service and now there's none to respond, those kinds of things. They just don't know that, and they probably wouldn't understand it if you tried to explain it to them. So the best bet in those situations is just do it. I mean, that's what you're being paid to do. That's what we're being paid to do. We're being paid to go pick people up and run calls. It's not our job to pick what calls we run. We just got to go run them. That's a hard pill to swallow, but it is the facts. It is the truth of what we do. Of course, we need to also recognize the signs of that compassion fatigue so that it doesn't interfere with our own work life. You know, sometimes we get so tired of being sympathetic and empathetic to the patients that we take care of, we're no longer sympathetic and empathetic to our own family members. It's really easy to do, and it's really hard to combat. It's really hard to seem sincere, you know, to your child that has, you know, got stung by a bee, you know, when you literally just come home off a shift, you know, 3 hours earlier, where you worked a kid that got his arm, you know, mutilated by a lawnmower or something. It's like, geez, it's just a freaking bee sting. But you have to be really careful with that, because these are not people that you're just going to be around for 15 minutes and drop them off at the hospital. These are your family members. These are things that you say at those times are damaging to relationships. So be very careful, be mindful of compassion fatigue, and try to recognize that. Try to be sure that, you know, you stave it off. Excuse me. So we got to cope with our own stress. Look for those warning signs. Identify your reaction to that fight or flight stuff. You can use deep breathing, some relaxation techniques. Yoga is a really good method. Meditation are some good methods. Of course, focus on the immediate situation. You know, some of those things are only going to work after the fact. You're not going to be able to do it in the heat of the moment. Ahead of time, if you get enough rest, of course, exercise, talking to coworkers is what always helped me. I've also talked to counselors. I'm not afraid to go talk to a counselor and tell them, "Hey, look, I'm in over my head. I'm really stressing about this. I need to talk." You know, and of course, I always worried, you know, at the time that I'm telling a counselor some, you know, crazy story about some call that I went on that has me a little messed up, that how much I'm messing them up. You know, it's like, hopefully my counselor has a counselor, because, you know, listen to these stories might not be great. But don't be too proud to reach out and talk to a counselor. Talk to coworkers. You'll oftentimes find that your coworkers are feeling much the same way. You know, so you're not alone in that. And misery loves company. So sometimes it is helpful to talk to somebody about it.
Suck it up. Get over it. That's what we were always told. We were never allowed to have emotion. As she mentioned, I am a paramedic, have been for 24 years. I joined the volunteer fire department when I was 19 years old. I'm not doing that math for you. But for my entire adult life, I've been doing this. I've been watching and seeing people in their worst. Suck it up. Get over it. You have to get back out there. Man up is what we keep being told. Well, I'm here to tell you that I have post-traumatic stress disorder. For a while, that was something I hid, I was afraid of. I didn't want anybody to know about. But I embraced it finally, and it took a few things. So my story is what I'm here to tell you today. What I'm here to tell you is suck it up and get over it doesn't work. In fact, it makes it a lot worse. A lot worse. See, some of the problems that we have, post-traumatic stress disorders, become out in the forefront. The military, our returning veterans, have really brought it out and made it more prevalent in society. People are able to talk about it. If our heroes, if the people who were the strongest and the bravest of this country could suffer from this debilitating disease, and yes, it is a debilitating disease, you'll hear about that in a moment. If they can do it, then what about the average paramedic? Now, I'm not about to sit up here and tell you that I have experienced anything like combat whatsoever. However, the trauma on a day-to-day basis, the tragedy on a day-to-day basis. So EMS has always been the little brother of the police department and the fire department. We've never had the respect or any kind of the rights that all the other ones have gotten. They don't even get our title right. Anytime you hear anybody say police officers, firefighters, and emergency workers, can you get my title right? No, or the dreaded, even worse, ambulance driver. That one I love. Yes, I drive an ambulance now and again, but it doesn't define who I am and what my education shows. It doesn't define it. So when I think ambulance driver, I still think that the public still thinks to this day that we all have white coats, white pants, we drive souped up Cadillac ambulances, we run as fast as we can, we scoop up the patient, we bring him to the hospital. That's not the way it is. Besides, can you see me in white pants? That right off the bat would make me define another career. But I never got into this for accolades. I didn't get into this to be on the level of the police officer, to be on the level of the firefighter. I wanted to do what I wanted to do. I wanted to make a difference in people's lives. I wanted to go to work every single day and save a life. Now, no, you don't save a life every single day, but you can make a difference every single day. But along with that difference, along with that wonder, along with the good jobs, comes a lot of the bad ones. And I'm also here to tell you that it isn't the big things that make us worse. The 9/11s, the Oklahoma City bombings, the Parkland shootings, those are terrible incidents, tragic, absolutely tragic, and will devastate a practitioner, devastate a provider, devastate police officer, firefighter, anybody who's involved. But it's the little things, the day-to-day stuff. Every single day going to work, the infant, the 2-month-old in cardiac arrest that you know you can't fix. You know your efforts are futile, but you're trying like hell anyway. The 80-year-old, the man who was married for 60 years and he was in cardiac arrest, that you're on the floor trying to resuscitate him, and you look up and you see his wedding picture from 60 years ago. And then you look his spouse in the face, knowing that her world is about to crumble. It's the little things, the gunshots, the stabbings, the mangled vehicles, the constant tragedy every single day. We see people at their worst. And probably one of the worst parts about our lives and our profession is our successes are hidden. Our failures are very public. So I have a good friend of mine who would tell you, suck it up, get over it. You knew what you signed up for. This was you. Nobody told you to do this, put a gun to your head to do this job. Suck it up. Stop playing the victim. Because people rely on you. People need you. They need you to be you. Not drop into the fetal position and suck your thumb every single time the radio goes off. Well, I will tell you, there are not many things in this world that I am good at, but I am damn good at this job. And no matter how bad I've gotten, no matter how dark my life has ever gotten, I've gotten up when that radio went off. And you will get my best. And as a matter of fact, I've gotten better. I've gotten more compassionate. I've become a better provider because I had an epiphany. About 12 years ago, I was working 2 full-time jobs. For those of you who aren't familiar with EMS, we used to call EMS earn money sleeping. I could go to a job and go and get a few good power naps. To this day, I can sleep better in a vehicle than I can in my own bed. I can sleep better in a chair. But I was working 2 full-time jobs. I used to work a day tour in Corona, Queens, and then I used to go right to an overnight in South Jamaica. Not 2 very good areas if you're familiar with the area. When I was in the middle of a nap, it was a beautiful nap, as a matter of fact. One of those really good mouth-drying naps. And I got woke up for a hanging. And I was pretty burnt out at the time. So I went to a house, and there was a basement apartment, and there was a gentleman who was 5 feet 11 inches tall trying to hang himself off of a 6-foot ceiling. For the record, that doesn't work. So in my burnt out state, in my really poor state, my mental condition was so bad, or was so burnt, so Cajun, as we used to like to call it, I treated that man like crap. So as I was back in the ambulance into the ER bay, a good friend of mine, my hero, the man I wanted to be, the man everybody wanted to be, he was the life of every single party he went into. If you worked with him, it was wonderful. It was the best tour you'll ever have in your life. He actually had the best parties. Backed me in, I opened up the doors, my partner walked that gentleman into the ER. We didn't even give him the dignity of a stretcher. That's how bad it was. So my good friend, my hero, had said to me, what do you got? Some jerk screaming for attention, tried to hang himself. And I got a verbal kick in the gut to one of the people who I respected most in this life, looked me in the face and said, wow, turned and walked away. Well, I chased him down and said, hey, how about an explanation? And his exact words to me were, wow, all these years I've known you, I didn't know just how big of an asshole you really are. He turned around and he walked away from me. Now, this is a man I spoke to 1, 2, 3 times a day, depending on the sports season. We would talk all the time, never talk to me, he wouldn't speak to me. We finally got into the truck one day when I had to work with him, and after an awkward silence, I said, what happened? What's the deal? What did I do? And he woke me up like I've never been woke up before. He said to me, Tony, do you have any idea what must have been going through that man's head? You have any idea what he must have been thinking? That death was his only relief from his pain. Even if it was a cry for help, it didn't matter. Death was the only relief he had. And then he told me something I couldn't believe. He told me how bad his depression is. Crippling depression. Depression that would make him literally be in bed for a week. He used to get hurt on the job. Wasn't hurt. Couldn't get out of bed. It was right then and there that I knew you never know who you're sitting next to. You never know the demons that they're battling. And then he punched me in the face again. And he said, my friend, you're hurting. He said, you don't realize it yet. You haven't accepted it yet. But you're in trouble. You need help. You got to get it soon. And it's funny the way life works sometimes, because I didn't even know this, because at my other full-time job, all of my friends were talking to my bosses and telling them, Tony's in trouble. There's something wrong. He's not acting right. He's in a bad, bad place. So I was forced to take a vacation. And that forced vacation really woke me up, and I actually reconnected with my hero, and we got some therapy for me. I started seeing a therapist, and that fizzled out really bad, because I was not ready to stop sucking it up and getting over it. I didn't want to talk about it. I didn't care. Self-reflection was... who cares about self-reflection? Give me a break. I'm tough. I'm a paramedic. I am a New York City paramedic, damn it. I'm tougher than this. So what happened? I fell right back into the same destructive behaviors. Started working more, as a matter of fact. I had 2 full-time jobs and a part-time job. I was working roughly about 110 hours a week. So this is what happened. I was partying hard and working harder. Working hard, partying harder. So what? If I wasn't at work, I was at the bar. If I wasn't at the bar, I was at work. Every once in a while, we throw some golf in there too. But now that I think about it, there's a pretty big bar involved in golf as well. See a pattern? So I started drinking pretty heavily, and it started getting worse and worse. And I started getting into a darker and darker place, but I had an outward persona that was wonderful. I was a happy guy. I was my hero. I was putting on a facade. But deep down inside, I was terrible. I was hurting. I was in pain. And then I got a phone call that changed my life. Late one night, I received a phone call from someone, and it was an apology. It was an apology for sexually abusing me when I was a child. Now, I remembered that, but never accepted it and never really went with it. Didn't want to deal with it. Suck it up. Get over it. Well, I went into a deep despair. I went to fear, guilt. I felt guilty that this happened to me. I had no help, no support. Didn't want to talk to any of my friends about it. So guess what happened? I started drinking more. So fast forward about 6 months until I was in my darkest place. I'm sitting in my man cave, which I'm very proud of, by the way. In my man cave, highly intoxicated and ready. I took out a bottle of Vicodin. I poured the pills in my hand. And that was it. I was done. Pain was too much. I couldn't do it anymore. I knew what that gentleman who tried to hang himself felt like. I knew that the only relief was to end it. And like a strike of lightning, my phone rang. 11:30 at night. was a good friend of mine. He had to tell me about a story he just heard in the bar. You aren't going to believe this. You are never going to believe what he said. And we sat there and we talked and we talked and we talked, and I laughed and laughed and laughed. And as I laughed, I put the Vicodin pills back in the bottle and I lived for another day. And there's one thing I've always overlooked. One thing I've never accepted, one thing I've never really done, and that's thank him for doing that. And he's here tonight. So thank you. He saved my life. I lived a little more time, and 4.5 months later, my 4-month-old daughter is sleeping 2 flights up. And she was a great baby. Unbelievable. That baby slept from the moment she came home to the moment she turned about 1 or 2. She actually, I keep saying, she suckered us into having the second, because now neither one of them will sleep. Notice the bags under my eyes. And I was sitting down in my man cave again, intoxicated. See a pattern? And I couldn't take it anymore. The pain was just too much. And this baby, this child, who never woke up, who went to sleep at 8 o'clock and woke up at 9 in the morning, never stirred once. I poured those pills in my hand, and she started screaming bloody murder. I had no idea what was going on. It scared the ever-living bejesus out of me. I've been a paramedic for most of my adult life, and when your children get hurt, oh, all bets are off. I become a blubbering idiot. So I ran upstairs, and I grabbed her out of her crib, and I started rocking her. We sat on our chair. I started playing John Mayer on my phone. Don't judge. She liked it. And I looked down at her face. And I said, she needs me. She needs me. So after that, I started to make a change. My wife, who has always been a supporter of mine, always listened to me, always been there to help me laugh, help me cry, always there to sometimes just not say anything. I needed to do it for her too. And I needed to know that this was going to be my chance. So I started calling therapists immediately. And for the record, I had already tried 3 therapists. But guess what? Luck would have it, the 4th time's a charm. And we clicked immediately. And she zeroed in immediately on my childhood. Because she said, your childhood is the reason that you're feeling the way you're feeling because of your job. Your childhood, that trauma, is because of everything that you've experienced. This is what you have to fix. So after tons and tons of self-reflection, which hurt, and it was terrible, and it was awful, it was so painful, sometimes I couldn't speak after I was done, I started to get better. Prior to this, I had ballooned to 450 pounds. I was drinking a gallon of coffee a day. I even started chewing tobacco. I was committing suicide by food and alcohol. Well, I'm proud to say that after getting my head straight with my therapist and my family and friends, I'm 140 pounds lighter. I go to the gym 5 to 6 times a week. It's actually become somewhat of an obsession. And I don't suck it up anymore. I don't do that. I don't let anybody feel that they have to suck it up. I talk to everybody that will listen in regards to this. It's okay to not be okay. It is okay to be hurt. It is okay to feel emotion. It is okay to cry. It's okay. My wife and my best friend will tell you I cry more than I probably should. But it's okay. I've lost a lot of friends to suicide. I've lost a lot of friends to drugs and alcohol. And I'll tell you, if one of them just had a friend that made a phone call at 11:30 at night to tell you a funny story, maybe it would work. Maybe they'd still be here. If they had a 4-month-old that screamed at just the right time, maybe they would be better. Maybe they wouldn't be fighting the demons that they're still fighting. Suck it up doesn't work. If you are in this field, if you know somebody Keep an eye on things. Make a phone call. Send a text message. Just check in. Sometimes the littlest things can make the biggest of difference. That's all I'm asking for. I won't give up. I won't stop. My wife knows that in the middle of the night, at 3 o'clock in the morning, my phone rings, it's somebody that needs to talk or somebody that needs me, I will get in my car and drive wherever I have to go. I will not let people be alone. I will not let them be the way I was in that man cave. I won't do it. So all I'm asking is you do the same. Suck it up doesn't work. From the bottom of my heart, thank you for listening.
Anthony still has the man cave. I've known Anthony for a few years now, and he's truly a great guy. He's got some amazing stories to tell. I've worked with him on a project or two. I haven't seen him in a couple of years, but he's a really good guy. But what he speaks about is true. I mean, it's burnout. For a number of years, we didn't recognize it for what it was. Like Anthony, I've lost friends of mine that were medics to suicide because of this. I've lost them to drug and alcohol. And it was all related to them just getting completely burnt out, and just trying to push too hard and do too much, and reaching that physical and emotional exhaustion level. And of course, it's all because of stress, and that's what theirs was as well. But the problem was then we didn't recognize it. We do recognize it now. We know about it now. So you guys can avoid a lot of those things, a lot of those pitfalls that we dealt with. Of course, that timeline when it's going to happen to somebody it's just going to vary from person to person and job to job. We're all built a little bit differently. Some people may never reach that level of burnout. Of course, it's really important to avoid those kind of false beliefs that kind of lead to burnout. What Anthony was doing was working more jobs and drinking and partying and all those kinds of things, thinking that he was blowing off steam and fixing his burnout problem. And that's why he didn't think he needed help. But the reality of it is he was contributing to it. He was making it worse, trying to self-medicate and do those kinds of things, and it just didn't work out. Fortunately, Anthony's still with us today, and still providing helpful insight into the life of EMS. And of course, there's some paramedics out there that literally don't deal with burnout, or they deal with it on such a minute level that we don't recognize it, at a high level. They step away from it. They take a break. That's what I did. I stepped away from it for almost a year, a year and a half. I did something completely different and then came back, and I was refreshed and ready to go again. But it's good to deal with that burnout in whatever way you need to. Of course, inevitably, we're going to have to deal with different stages of death and dying, and that can be really stressful. It could remind us of a family member or a loved one or a friend that we watched to go through that pathway or go down that road. Or it just could be difficult or tough dealing with family, the family members of the loved ones wanting you to do something when there's nothing that you or anybody else could do. But also, we need to make sure that anybody that is at this stage in their life, that they're able to go through that phase of their life with dignity and honor. In some cultures, births and deaths are really a holy time, and we need to make sure that we keep those things in mind. We don't have to believe or agree with whatever it is they're doing to be respectful of it. And we should be respectful of it, because this is a time that can't be redone. It's a time that they have very specific things that they feel like they need to do for their loved one. And it's important to allow them to do that as long as it's not going to interfere with any care you're trying to provide. You're going to come across a whole lot of people with a whole lot of different beliefs, and just a whole lot of different ways of doing things. So keep that in mind. The grieving process hasn't really changed. There's really 5 stages of it. denial, anger, bargaining, depression, and acceptance. People can go through all 5 of those stages quickly. They can get stuck on one stage. Doesn't necessarily mean that you'll do those stages in that particular order either. There's just, those are those stages. It is entirely possible for those stages to go out of order as well. And someone can get stuck for a prolonged period of time on one stage, while somebody else may just breeze right through the whole thing and manage to be able to deal with their emotions, fairly well. They might be able to cope with it pretty well. Dying patients are some of the hardest things to deal with. They typically know that they're dying. Some of them even joke about it, and seem to take it pretty well. Fortunately, and it's probably why I stayed in EMS and didn't, venture into nursing or anything like that. By only spending about 15 minutes of time with our patients, rarely did I get too attached to any patient. There were some, obviously that you would run on pretty regularly that, you get kind of attached to them because, you're looking out for them, you're taking care of them, and it's just that particular situation. Those were always tough, when you knew you were going to lose them. But, don't discount the fact that you going through or watching somebody go through this stage in their life isn't going to have an impact on you in some way or another. But realize patients still need to have some control about how this happens, how things play out. So we need to make sure, once again, that they're able to go through this with dignity. And of course, families, oftentimes we're not typically called for someone passing when it's expected. We're typically called for when somebody passes away when it's unexpected. And this is when it's really tough to deal with the families, because the families, they want you to do everything that you can, and sometimes everything that you can do is nothing, because there's nothing that you can do. Try not to hide the body from the family. It helps them with closure. And it may be helpful to be by their side and answer some questions and those kinds of things. Don't use euphemisms, and don't hurry to clear away resuscitation equipment. It's good for them to see all of that kind of holistically, to where that they, in their mind's eye, they see that all of these things were done, that you did all of these things. Give them some time with their loved one, with their family members, at least as much time as possible, as that's reasonable. Oftentimes when it comes to this phase, they're probably at the hospital, but it could be that they're there at the scene. In Oklahoma, we don't transport someone that we've pronounced dead, so we'd wait on the funeral home. Typically, if time permitted, I would try to hang out until the funeral home got there, and then kind of make that transition with the family to the funeral home, the people from the funeral home, because they're really good at dealing with that, far better than we are. But whenever that was possible, I would try to do that. Wasn't always possible. Sometimes they were going to the medical examiner, and that was a whole different route. So try to help arrange for further support for the family. There were many times, calling the funeral home, helping with some of those arrangements, because sometimes they just don't know what to do. Or I'm, calling other family members because, Anthony mentioned, the 80-year-old that had been married for 60 years and the little wife is standing there. They're not going to think clearly. So it's like, do you have a son or daughter that I can call? Do you have siblings? Who do you need me to call? And then you make that phone call, and then the family can kind of start piecing things together. But you want to get somebody over there so you're not leaving this poor little woman at home by herself, when you leave, and she's there in an empty house, if she can be surrounded by family. So children are very different when we have to deal with them. Their understanding of things is different, and they struggle with that. So you want to be careful of their emotional needs. Children up to 3, they don't really even know what's going on. They just have the perception of the adults being upset, and that impacts them. 3 to 6, they believe death is temporary. They believe they're going to come back. They find it extremely odd that they buried grandma in a big grassy field with a whole bunch of stones in it. It's very weird to them because they keep thinking grandma's going to come back from there. So 6 to 9, they start to get pretty good at masking their feelings and kind of holding things back and not wanting to open up and share those things. So they start to get really tough. And 9 to 12, they start to want to know some details. They want to kind of know what's going on. They get a little more inquisitive about it, if they're able to open up and willing to open up. So once everything's all said and done, everyone that's involved in a really bad call is likely to experience some pretty intense feelings. And even if you've been on that kind of call before, it still can have an impact on you. Just don't hide your feelings. Be willing to talk about it. I was always willing to talk, and perhaps that's probably what benefited me and how I've managed to have, I worked, 15 or 16 years in the field before I moved into education side of things. And I credit the fact that I wasn't afraid to tell somebody that a call that I went on screwed me up. You go on a call that was one of your coworkers that's committed suicide on your shift, it's going to mess you up a little bit. And you got to be willing to talk about it. You got to be willing to say something to somebody. And there was a lot of long talks about that. Many times. A lot of late nights talking to my friends because my spouse didn't understand that. My parents didn't understand that. They had no idea what that was like. What was that to deal with? So don't hide it. Make sure you share it. Your service probably has some sort of debriefing procedure, and maybe something that they do for critical incidents and critical incident stress management. Of course, PTSD, I think it's overused a little bit. I do 100% believe in PTSD. I'm not saying that it's not real. I just think that it's a term that's thrown about a little bit too easily or too readily. While we all have stressors and things that we remember as stressors, that doesn't necessarily mean that it's PTSD. There is some legitimate PTSD out there. I don't feel like I suffer, in all of what I've seen, that I suffer from PTSD. Although I might and just don't know it. Maybe I'm just that clueless, and that's entirely possible. Critical incident stress management, of course, is a resource that some places have, not all of them have, but typically when there's a major incident, they can bring those in. There's outside sources, other agencies, larger agencies, sometimes have those resources that they are more than willing to share, to send their people down to help with those kinds of things. Of course, reactions to these events you just can't predict how you're going to respond to them. So it's important that we allow for some debrief time, that we get people talking and we work through those things. And of course, we can't ever share anybody or make debriefings mandatory, but we do want to make sure that we plug them in with the resources. If they don't want to share in a group with the coworkers and that kind of thing, make sure you give them resources to where that they can go see a regular counselor. Anthony talked about he wound up going to 4 before he found one that fits. Make sure you find one that fits. It's important that you got someone that you're comfortable with opening up to. I thought that was an odd concept until I went to a counselor myself and realized, hey, it does matter if your counselor just really fits and you really click with them, because you have that level of comfort with them. So take the time, find the right one, and then keep the number handy. You're probably going to need that person for the rest of your life, even if you're not in EMS. We need a counselor from time to time. So it's not just EMS that messes us up. I'm hoping I haven't scared anybody off from a career in EMS. Life screws us up. If you don't experience traumatic events, as a medic in the field, you're going to experience traumatic events in your life. You're going to come across car wrecks. You may even be involved in a car wreck. Some of you may have already experienced traumatic events. It's just a matter of time. It's a fact of life. What really matters is how you deal with those, and how you get over them, what we do in the end. So all kinds of employee assistance programs out there with trained professionals that are willing to help. In fact, you probably know this by now, but I want to make sure that everybody remembers that Gordon Cooper actually has a counselor on staff, and she's here typically 5 days a week. But she is at your disposal. Anything you share with her is 100% confidential, like it is with any other counselor or counseling session. So, that resource is available. Get a hold of any one of us, and it doesn't have to be something related to a call. You could be stressing out about class or, life or anything like that. It can be anything. They are at your disposal. You're one of our students. That is your resource. Just get with me, Lacey, or Curtis, or even Nicole, and we'll point you in the right direction. We'll give you her number, and then what happens from there is between you and her and nobody else. Nobody will know. So that's a program that we've got at the school for you guys, that you're welcome to use. The last thing that we'll talk about, and yes, believe it or not, this is the last slide. I really didn't think this slide set would go this long, but it has, and I am sorry. I forgot Anthony's speech was a little bit longer. His TED Talk was a little bit longer than what I recalled, but it was well worth it. So peer support and suicide prevention is really important. 100% medics are not above suicidal thoughts and suicidal ideation and suicide attempts. I can just think right off the top of my head, I know 4, maybe 5 medics over the course of my career, probably the first 15 years of my career, that committed suicide. I know of a couple of them that died of drug overdoses. And it's all related to the stress of the job and the stress of life. The job was not the only stressors they had. Many of them had lots of problems at home. They had very poor coping mechanisms where they turned to drugs and alcohol to cope with those kinds of things. It was not the job that got them. It was how they dealt with the job and how they dealt with their personal life that got them. So it's really important that we look out for each other, recognize it, speak up, say something to your partners or someone you're working with when you recognize that they're just absolutely overwhelmed, and let them know you're there for them. On that note, I want you guys all to realize that if you don't feel comfortable talking to a counselor, or if you want to talk to Curtis, Lacey, or myself, our offices are always open. Our doors are always open. We're more than willing to listen, let you vent, let you get it off your chest, let you talk about it. We're not experts and we're not professionals at teaching you coping mechanisms and those kinds of things, but we're more than happy to listen if you need someone to listen to you, to talk to. A lot of our former students do come back and either talk to one of the 3 of us. It's not uncommon for them to say, hey, I've really got this call that's really messing with me. You got time to talk? And it's like, sure, I'll meet them on weekends after work or anything like that. So if you guys ever come across that, don't hesitate to, I for sure won't let any of you guys be a statistic. So just, reach out to us and we'll help take care of you. That being said, chapter 2 is over. We got one more chapter down. All right, good job, guys. We'll get back together on the next lesson.